we actually were very excited about it because it is an entirely different type of project that than we had ever done before. And we talked about social media and how social media is becoming increasingly important as communications and channels. And really, we had two primary questions that we wanted to ask. Is that how are individuals across the globe engaging in social media content? And then secondly, having known that, how can we as individual organizations and then the GLCC as a group create better campaigns or messaging in order to have more effective social media communications? So I must say that this is one of the most interesting projects that I worked on this year, and we end up with volumes and volumes of data. It was something like 400 slides that we ended up having to condense. So right now we're going to talk to you about the methodology. We'll present a little bit of the data here. When we do the partners meeting on Saturday, we'll present a different part of the data, and then at the meeting on Sunday, we'll present something else as well. So that provides one, interest, and you guys don't have to listen to the same thing, but two, also incentive for you guys to come out so Simon and I aren't in a empty room on Sunday morning. So social listening is what we did. We kind of listened to the wide world, and we can see why we need to do this is because if you look at the statistics here, you can see that the social media and is really prevalent across the globe. And the average person right now across globally, according to latest Hootsuite data, spends about 6.5 hours online. And the social media is quickly forming the highest proportion of that. What did we do here? Well, we did both social listening, what are people saying online, and then we did social content analysis. And social content analysis took a look at what we, all of us, are saying as member organizations at the GLCC and the GLCC website and social media channels, as well as other lung cancer organizations, and took a look and analyzed that for what is being best received, how are they being received, and what we can do better. So this, for this presentation, I'm going to talk a little bit about the social content, and then on Saturday we'll present the social listening. So how did we choose our countries? We ended up with 11 different countries across the globe. We tried to get global representation. We had at least one from every continent, and then we looked at South Africa as well, and we looked at Russia, we looked at Poland and India and China, and we chose these based on a geographic representation, but also took a look at their health quality access index and social media usage. So for the most part, we were able to do Twitter, Facebook, Instagram, Reddit, but for Russia, they have a social media platform which I cannot pronounce. I think it's called Konkati. Don't know if there are any Russians in the room, please correct me. And then for China, because of the censorship, we did Weibo and another platform that they use. So this is how we define social media. And for the social listening analysis, which you will hear on Saturday, we were unable to, because of the privacy issues recently enacted, use Facebook. So we used primarily Instagram, Twitter, and Reddit. And then for this part of the organization, the social content analysis, because all of our pages are public, we were able to include the Facebook information. So, how are we being heard? I'm just going to present the Facebook information at this point. And really, for the social content, we wanted to look at it from 4 different themes. What is the topic that is most engaging? When should we be communicating with our members, and when are people listening? How much should we be communicating? And what is the type and the format that is most engaging for people? So we ended up with a lot of data. And we actually analyzed, there were about 54,000 pieces of data. And then after that, we took about 1,000 pieces randomly and analyzed them for the themes. There are certain limitations, definitely, to the methodology that we used. Because there was such a volume of data, this is machine curated, so definitely there could be some discrepancies there. In order to select the 5 key topics, we took the 1,000. So if anything, if our random sample was not so random, then that could be influenced that way. There is a discrepancy between our social analysis, content analysis, and the social listening because of the Facebook proportion. And also, there is a little bit of a location bias because many of the top organizations are US based, but the users seem to reflect global in nature. Oh, I think I went backwards. So 65 different organizations were evaluated and we generated 2.5 million plus engagements over the period of time between June 2017 to May 31st, 2019. This is just an overview of the data set and how we arrived at the 2.5, and these are the 5 themes that were predominantly identified. So events, fundraising, medicine, and technology and treatment, studies, research, information, and survivor stories. And so I'm just going to present the Facebook today so we can leave time for discussion. We did analyze Facebook, Twitter, Instagram, YouTube as well. So I found this fascinating in terms of the themes and what performed better. So what you can see on the bars represent the percentage of the content and the types of content that we put out. The line graph talks about receptivity. So it's really interesting that both the GLCC membership and the other organizations, we tend to put out a lot of information about studies and research and new research findings, et cetera, but they tend to underperform in terms of how they do relative to the amount of content that we put out. What tends to do really well are events. Events are things like our Global Lung Cancer Day in August 1st, Lung Cancer Awareness Month, local events that are happening. Those tend to get a higher number of engagement, and that was consistent through both GLCC membership. And then survivor stories tend to do well as well. This is talking about the Facebook types that we see are put out. So photos, links, videos, albums, and live videos, photo carousels, and GIFs. We can see that the photos and the pictures tend to do really well. But in terms of something that we seem to underutilize is that photo carousel. Now, photo carousels are not used very much, but they tend to outperform in terms of engagement. What doesn't perform very well are sort of our links. We like to send links out on Facebook, but they don't. Sorry. Oh, okay. So a photo carousel is when you click on your Facebook and then you're able to swipe across to get different photos. As opposed to a photo album where you see like different squares and it says plus 15 or something like that, and you have to kind of tap on that and then you get your photos in a square. People like the convenience of being able to be able to swipe through. So other things that tend to outperform but we don't utilize very much are videos. Videos tend to outperform as well. Now this was very interesting to me. This had a lot of aha moments. And as organizations, we tend to think traditionally when it comes to communications. We need to communicate we communicate around our work day and our work hour, but that's not when people are listening. So the day that got the highest amount of engagement, and yet we talked the least, was actually on a Sunday. So when you think about it, it makes sense. This is when people are listening. These are when people are not they're home from work, they're just relaxing, they might be catching up on their social media, and so this is the Saturday and the Sunday tends to get us the highest level of engagement, and yet we tend to post most on Wednesday, Thursday, Friday. So I can tell you that these insights actually have helped us in the organization, because for World Lung Cancer Day on August 1st, I had the privilege of having a sneak peek at this data. So we actually tried it. We we did a post on Sunday, and then we also posted at 7 o'clock and at 8 o'clock in the morning, and then at 12 and 1, and then after work. And compared to last year, we did see an increased amount of engagement as well as retweets and reposts. So these are just the engagement trends, and you can just see that they do trend around the awareness days. So this is some of the summary and recommendations of what we talked about here. Facebook does tend to be the most important and most frequent used amongst all of our organizations, and it continues to be a primary focus globally. The content is really critical for Facebook, and really what we did find is is really no correlation between the volume of posts and the engagement that you have. So it's talking about quality being more important than quantity, and just timing. We have to, I think with social media, we have to really, the audience is different than our traditional communication channels where we might put out a press release during daytime, during working hours. Now we have to think about, when are people most active on Facebook, and using that timing and scheduling our posts to coincide with when people are listening. And so links really do struggle on Facebook. Across all the organization, they tended to underperform. Users skewed towards female and elderly, which tend to be consistent with the general Facebook trend as well. And how do we use survivor stories to increase our engagement? And how do perhaps we like to share medical information. We like to share research and studies. So perhaps how do we use survivor stories to share that information so it's presented in a more interesting fashion? And I can tell you that this too did work. We tried this, we have been trying this, and it really has increased our engagement level with our community as well. So I'm going to stop here, and we can have a little bit of a discussion. There's so much stuff that, data that came back that I think there's lots of different ways we can go, but this is just the start of it. Simon, is there anything you want to add?
Just that, unfortunately, obviously you missed the presentation that we did about the GLCC channels.
I know.
And I think you'll probably see that there was quite a strong correlation between what we were attempting to do and what's been validated by the data that's come through from there. It's certainly obviously given me a lot of extra pointers in how to program our output for the next year, etc. One of the things that we've been doing in our own organisation back in the UK, in Roycastle, is precisely that thing about timing our postings. One of the things that I discussed while giving my own presentation about what we do was precisely the thing about survivor stories and making things personal. So on the one hand, you want to be able to talk about events, you want to be able to talk about data, but you also want to be able to talk about things in a personal context, and those two things do secure greater engagement, and it's wonderful that this data set has definitely endorsed that. One of the things that has come out of this, there is so much data that Christina and I are going to sit down. The next thing that we will be doing is sitting down discussing how we're best going to concisely disseminate this towards members. Sorry, Jeff. Yes.
I hope so. I'd really like to. We are going to write it up.
Yeah. There will be a paper of some description.
Does this information surprise anyone, or am I the only one that found it fascinating. I'm elderly.
Young people these days, they've got no comprehension. Yeah.
No, I think some of it works, but I think it informs the way all, I mean, I'm sure none of us are doing everything to optimal levels, so it's wonderful.
Can you tell us, Christina, how many of the Facebook users with lung cancer interests are patients or they're information-seeking relatives and carers? So the reality is that that's going to bias. You can't. Okay. That will introduce a female bias because women care, and men just get on with it. And if there is, let's assume that that's not a bias. Can you think of a plan to engage the missing?
I guess that's actually not the. It's the other channels that haven't been presented. Yeah,
Right.
What's interesting is that the Twitter and people who are on Twitter are very different than the people who are on Facebook. People who and Instagram is another channel that is very quickly growing as well. So these other social media channels play a role
Right.
into a more complete. But I think users of social media will tend to always bias towards female. Maybe with Instagram might be younger. Twitter will be more professionals type audiences. But there'll be nothing that will catch all, and will and the two traditional versus social media will tend to go hand in hand.
Is Instagram a potential here for people to rely? Sorry,
It
you
is.
asked the
I was
question.
going to present Instagram on Saturday. I was going to present the Instagram data on Saturday, but Instagram is the fastest growing.
That's really interesting because we're a small organisation at Lung Foundation Australia. We have almost 30 staff and one person to curate our social media content. So it's hard to know where to put your resources. Do you put it into Facebook and maintain that community? If you open an Instagram community, you have to pay attention, and as you said, that community is entirely different. So it'll be interesting to hear the comparisons and where patient organisations can get the most value and engage with their community.
It is very true. Lung Cancer Canada has a staff of 5, and so we're teeny tiny. we're so you're huge compared to some of us, but
Yeah.
but we
It's not all lung cancer.
this has definitely changed the way we approach certain our social media, and it is challenging because all of these channels need constant feeding, but resources are limited.
All right, so Christina and Simon, thank you. Now,